The year began with some new faces representing Boston at the State House. Among them is the new state representative for parts of the South End, Roxbury, and the Fenway. We'd like to welcome Jon Santiago. Thank you very much for being with us, Jon.
Happy to be here, Chris. Thanks for the invitation.
You were on our show last year. At the time, you were the candidate who was also a physician. What has that got to do with your mission as a state rep?
Well, I mean, I think many people up at Beacon Hill have second jobs. I happen to be a physician. I actually work at Boston Medical Center. I work in the ER there, which is in fact located within the district. I live a couple blocks from there. I think my position as a physician will influence my policy making. I see how things in the State House and the policies that are passed ultimately influence some of our most vulnerable communities. And I think it's given me insight, whether it's healthcare, whether it's the opioid epidemic, and which is affecting the South End. But I'm hoping to take those lessons learned there to the State House to impact and create some good policy.
The opioid epidemic is just about everywhere, at least in this country, but a lot of it comes to roost right in your district. Why is that?
That's correct. I mean, this is a national epidemic. This is an epidemic affecting the whole Commonwealth, but there's no doubt that this is the epicenter of the opioid epidemic in the city of Boston. And it's for a host of reasons. I think, for a long time, the South End has really dedicated itself to taking care of vulnerable communities. You have BMC there, Boston Medical Center. You have a host of services for people seeking substance abuse help. You have 2 methadone centers. So this collection of services has resulted in a situation where a lot of people are not just from Boston, but outside Boston as well, coming to that location to get services.
Well, a lot of people come there for the methadone because they cannot get medical treatment for
Absolutely.
their addiction in other locations. You have supported a bill that would maybe change that, right?
Well, if we look at the situation right now, there are 3 ways to treat substance use through medication-assisted treatment. It's with naloxone, Suboxone, and methadone. Now, you have about 40 methadone centers across the state. You have 2 in the South End. I would be a big proponent of how do we increase access to Suboxone. So Suboxone is something you can actually pick up at your primary care doctor's office. The reason why we don't have it across the state is for a whole host of reasons. I'm really hopeful that in the next couple of months, year or so, the commission that was established to look at MAT, medication-assisted treatment, will come out with some findings, in addition to another report that's looking at the situation. But the idea is if we can increase Suboxone across the state, I think people in their respective cities and towns all across the Commonwealth will go to their PCPs. I think that will increase access, but I also think that will decrease stigma as well, because you'll be able to pick up your Suboxone just like you can pick up your high blood pressure medication, just like you can pick up your cholesterol meds as well. And so if we can increase access to that, my guess and my hope is that we'll begin to decrease services in the South End, and particularly those related to the methadone center and the like.
I do wonder about one thing here. People with insurance know who their primary care physician is, but what about people who don't have insurance? Or what about doctors who don't want to accept certain kinds of insurance? Couldn't that interfere with your
that's what the study's looking at. So this commission was created to look at the barriers to medication-assisted treatment, and there's no doubt that stigma it continues to play a large role in this. What I can say is that Massachusetts has been a leader in allowing people to get insurance, and the vast majority of these people will get insurance. I work in the ER at Boston Medical Center, the safety net hospital in the state and in New England, and we meet people who don't have insurance all the time, but we get them access to insurance quickly. But make no mistake, this is a tricky, complicated situation. It's not just substance use issues, it's its relation to homelessness, mental health, housing, and so it's a complicated situation, but I think in expanding Suboxone across the state, I think we can make a dent in the epidemic.
What about the idea that Mayor Walsh recently explored up in Canada, having medically supervised injection sites? Do you think that's worth looking into?
Well, I think all hands on deck right now. I think the epidemic is that bad. We're talking about thousands of deaths per year. The number one, public health crisis in our country. And so I think all hands on deck. And so I think we should look at whatever works across the board. Now you have 2 different models. You have the Vancouver model and you have the Toronto, Montreal model, 2 different models. We'll see what works. I will say that these are right now technically illegal across not just the state, but federally as well. And so there are some political, some judicial hurdles to climb, but it's something to look at for sure. Because right now it's in the game of how do we decrease harm reduction. So what you've had is an increase in the epidemic of opioid prescription pills. That subsequently went to heroin. And now what we've seen over the past 4 or 5 years is a rise of fentanyl. So when I take care of an overdose at Boston Medical Center, 9 out of 10 overdoses have fentanyl in it. And so fentanyl is a short-acting drug. And so people will be shooting, 10, 15 times a day, shooting up to get high, but they put themselves at risk. And it's so potent that they could die with just one overdose.
I have to wonder, I know this is going a bit national here, but when you hear the president talking about using the wall to stop the opioid crisis, what goes through your head?
It's amazing just the ignorance with the situation. I mean, when you look at where the fentanyl's coming from, and without getting too deep in the weeds here, the vast majority of synthetic fentanyl, because it's a synthetic drug made in a laboratory, comes from China, and these are shipped over. They're not crossing some sort of border wall, if it were to be there. And what people don't know is how profitable it is. If you a gram of fentanyl, I believe it's 8,000 times more profitable than that of heroin. And so, because I needed to make sense, I mean, I would be in the hospital and I'd be taking care of patients, and I would offer them fentanyl because we use fentanyl for acute pain. And I had patients say, "No, don't give me the fentanyl. I'm going to die. You're going to kill me." But I started to, and that didn't make sense to me from a market perspective. You're killing your clientele, so to speak. But then I realized how profitable it was, particularly coming from these factories in China, and that's why we have a fentanyl epidemic right now, not so much a heroin epidemic. And so we thus have to change our tactics and our strategies because it's just so much deadlier.
Well, one strategy we should mention on our show tonight, because you've got a town meeting around this issue.
Correct.
That's coming up pretty soon.
Correct. So I think my role in running for office, I mean, I live in the South End. I live a block away from Massachusetts Avenue, so I see what's going on every day as I walk down to work or when I walk down to the coffee shop. So I get the needles, and I get the issues with homelessness and housing in the community. But I also understand as a physician who works at the epicenter of all this, that this is a public health crisis, and that I would say 1 out of 4 people in the state know someone who is having substance use issues in their personal life. And so it's something that I thought we had to do in the South End to get a hold on. I think there's a lot of frustration. They don't really understand what all the state has done and what the city has done. And make no mistake, Governor Baker and the legislature, with its leadership, has been very active on this. They've passed 2 omnibus bills, and they've moved the needle forward. But they'll be the first ones to tell you that this wasn't created overnight, and this isn't going to go away shortly. And so I think this meeting with the community is really about telling the community, we're the elected officials. I was recently elected, but that we're listening, we're engaging you, we want to collaborate with you. And we've been doing work. But how can we help each other, and how can I get you more informed? Because, you'd be surprised. There's a lot of support for these services in the community, but people are looking, how do we access 311 to pick up needles? What does an overdose look like? And so this is part education, part listening, but this will be the first of a series of meetings I plan to have with the South End, Laura Roxbury, because it's important to note that although the South End has been very active in this issue, vocally, that there are parts of the city of Boston, primarily underserved communities, Roxbury, Dorchester, where their voices haven't been amplified as much. So I'm looking to make sure that those communities as well have a voice.
This has been news, and we're talking with State Representative Jon Santiago. Representative, one of the other things that you've been looking into is the effect of fare increase on the MBTA. They're almost getting to be routine now, but you don't like this one bit.
I'm not. I take the MBTA every day. I don't own a car. I either take the 43 bus to the State House or the Orange Line. I just think that the number of rate increases over the past several years, with the lack of quality that's been associated with that, it's just concerning to me. I think about the people at Chelsea. I have a lot of friends who live there, particularly the Latino community, who accesses public transportation. And if you're increasing rates by 6.3%, this year, did it a couple of years ago. Who knows, to what end this will go to.
Well, I can guess there are people in the South End who can afford it, but on the other hand, where you work at the Boston Medical Center, the people going there, what about them?
Absolutely. It's the same, with my friends in Chelsea. These people can't afford public transportation. So it's not only can we make it more affordable, can we make it more accessible? And so those things I'd be interested in. And the South End, which is a dense community, if we can get more people on public transportation, we have to really incentivize public transportation. And I think this is doing the opposite. We make it so much easier right now to use Uber or Lyft. We should be thinking how we can incentivize public transportation instead.
Another issue you've been informed about in your district, budget cuts at the Blackstone School. The city's spending more money in the school department, but people say, what about the state?
Well, no, make no mistake, I believe the state's going to be very active on this. I mean, there's a bill coming from the House, from the Senate, multiple versions in both chambers, and then the governor has actually, jumped in the issue as well. So, I believe something will get done. What it will be, we'll see. But there's make no mistake that the communities, particularly in urban and Boston and the gateway cities, need some more funding to address what's going on in some of these underserved communities.
Thank you very much for being with us.
Great, happy to be here.
State Representative Jon Santiago.
Thank you.